Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is 23rd June 2025. This video is on a New England Journal of Medicine publication on June 20, 2025, titled Stem Cell Derived Full Differentiated Islets for Type 1 Diabetes. This is by the authors are from the Forward Study Group. Type 1 diabetes is caused by autoimmune destruction of beta cells, leading to lifelong insulin dependence and risk of severe hypoglycemia. Zimislecel, a fully differentiated allogenic stem cell derived islet therapy, aims to restore physiological islet function. In this phase 1 to 2 study, 14 participants, 12 received full dose of the islet cells, the stem cell derived islet cells, and 2 received half dose. Mean age of the participants were 42.7 years. Mean duration of diabetes 22.3 years. Full dose 0.8 to 10 to the power of 9 cells were infused into the portal vein. The follow-up was for 12 months. Outcomes measured include C-peptide, hemoglobin A1C, insulin dependence, safety. They use descriptive statistics. Results and key takeaways. All 12 full dose patients had restored C-peptide production, mean 1274 picomils per liter at day 365. Hemoglobin A1C dropped from 7.8% to less than 7% in all. Mean reduction of 1.81%. 10 out of the 12 became insulin independent, that's 83%. Time in the range improved to 93.3%. The coefficient of variation reduced from 36.3 to 20%. Neutropenia was 43% of neutropenia, most common. This is a serious adverse event. 2 deaths, 1 cryptococcal meningitis, 1 pre-existing dementia. All endpoints were descriptive, no p-values are reported. Key takeaways: Zimislecel restored islet function and insulin independence in most. Marked hemoglobin A1C and glucose variability improvements. Immunosuppression side effects are of concern, just like no different from heart transplant or kidney transplant patients. This study supports further trials for durable stem cell based diabetes therapy. Exciting news for type 1 diabetics if this works out. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.